Okay, so now let's start our discussions about the autoimmunity. So when we say autoimmunity, from the word from the name itself, okay, so auto means self, okay, self immunity, cells response, okay, so it's the body's immune system that attacks the cells that leads to autoimmune diseases. Okay, so these are the conditions in which damage, to organs or tissues results from the presence of the autoantibody or autoreactive cells. So with that, there's a loss of self tolerance. Okay, so there are many autoimmune diseases that are known to this date. Some include type 1 diabetes, lupus, right, or multiple sclerosis, or rheumatoid arthritis. Okay, so these autoimmune diseases are caused by, take note, your T cell mediated immune responses or the autoantibodies. Okay, so these are influenced by, it can be through genetics. No, when we say genetics, it can be via the major histocompatibility complex and non MHC or the major histocompatibility complex. Okay, it can also be influenced via the stress. Okay, so kaya importante talagang iwasan natin yung magpaka-stress. Okay, kasi ito talaga yung pinaka-reason, no, ng lahat ng mga sakit. Okay, so it's the most common cause, no, ng influence ng autoimmune diseases since it lowers the immune system's response, thus allowing self-antigens to be sometimes attacked by the self-immune system. Okay, all right, and so another factor now for your autoimmune diseases are the hormones, in which common dyan is yung mga babae. Okay, so ang tinatanong, which among, no, of the genders has or can have the autoimmune diseases or prone to have autoimmune diseases? It's the females rather than male. Okay, so there's also tissue trauma and also a release of the cryptic antigens. All right. Also, it can also be influenced by the molecular mimicry, such as your pinaka-common natin yung organism na Streptococcus pyogenes. Okay, wherein there's a formation of the anti-M protein, no, which cross-reacts with the cardiac myosin. Okay, and bystander effects, super antigens, epigenetics, okay, and post-translational modifications. All right. So, and your autoimmune diseases, okay, is also caused by these sequestered antigens, no, or what we call the cryptic antigens. These are the self antigens that are hidden from the immune system. Okay, so when we say cryptic antigens or the sequestered antigens, these are the self antigens that are hidden from the immune system, such as your humor proteins in the eyes or mga sperm cells. All right. Okay. So um, one of the common antibodies in the that are present in the autoimmune or that can cause autoimmune diseases is the anti-nuclear antibodies or the ANAs. Okay, these are autoantibodies that attacks or that is found in the nuclei of the mammalian cells. So, for example, the double-stranded DNA, okay, single-stranded DNA, the histones, nucleosomes, the centromeres, and the ENAs. Okay, the ENAs are the extractable nuclear antigens. When we say ENAs, these are extractable nuclear antigens. All right, in which these are group of autoantigens that are found in the cell nucleus. and some are in the cytoplasm, okay, of the mammalian cells. This can be extracted using saline solution. Okay, so simple lang, saline solution ang kanyang extraction. So one of the examples are the RNPs, or the ribonucleoprotein. Nucleoprotein, all right, or the Smith antigen, SM, or the Smith antigens. Okay, we have also Smith antigen, RO. I mean, sorry, the Sjogren, sorry, Sjogren, the Sjogren syndrome. Okay, Sjogren syndrome, SS, Sjogren syndrome, RO, or Sjogren syndrome, LA. Okay, all right. The SCL, or the tropoisomerase 70. SL stands for tropoisomerase. And we have the JO, which are the histidyl. Okay, the histidyl. Oh, sorry, histidyl trans tRNA. Okay, synthetase, and the PM1, which is associated in the polymyositis. Okay, associated in polymyositis. All right. Okay. So these ANAs are detected, no, to screen. Okay, take note, just to screen for autoimmune diseases. Okay, so these are maybe performed using the ELISA test, or the enzyme link immunosorbent assay, and indirect immunofluorescence, so such as the fluorescent anti-nuclear antibody, or the FANA testing, which is, take note, the gold standard for your anti-nuclear antibodies. Okay, so the substrate, okay, the substrate in this test, they use the substrate HEP2, or the human epithelial cell line, in which the patient's serum is added, with the HEP2, which is the substrate, on a slide. Then after that, it's being washed, and after washing, all right, just to remove the impurities, there's an addition of the fluorescent labeled antibody, human immunoglobulin. Okay, anti-human immunoglobulin, I mean. Then another washing is performed. Then after that, the sample, or the specimen, is being viewed under the microscopy. So we will check, all right, the presence of the fluorescence. Okay. So now the titer of these antibodies, okay, with the maximum or more than 160 na titer, all right, is already considered as significant, okay, for autoimmune diseases. Take note, a titer of more than 160 is already significant, and which is also a suggestive now of the autoimmune diseases. All right. So what are the patterns, okay, in the microscopy that we have to observe? These are, take note, the homogeneous, peripheral, speckled, nucleolar, and centromere. Okay, homogeneous, peripheral, speckled, nucleolar, and centromere. When we say homogeneous, these are diffuse. Okay, homogeneous, these are diffuse, and such ANAs, anti-nuclear antibodies, are the anti-DNA, okay, and the anti-histone. Okay, so take note, homogeneous, anti-histone, okay. And so when we say peripheral, no, yung kanyang fluorescence is rim or outline lang, okay, ng cell. Alright, so these are mga anti-DNA and mga anti-lamin. When we say speckled, these are your anti-RNP and mga anti-Smith. Okay, speckled and Smith. So sa alphabet Q, R, S. Okay, so R and S for your speckled. Okay, para ma-remember. Nucleolar are anti-RNPs. When we say centromere, of course, para di malimutan, anti-centromere din siya. Okay, so letter C is into letter C, anti-centromere. Ang centromere, in which this pattern known as centromere is common sa crest diseases. Okay, so crest, ano ba itong crest? These are limited symptoms no na makikita sa scleroderma. Okay. So ano daw ito ng mga simptomas? Okay, these are the scleroderma na symptoms, okay, na makikita sa scleroderma. All right. So these are no the abbreviation of the symptoms, okay? So the calcinosis, in which when we say calcinosis, it means there's a calcium deposit sa skin. Okay, calcinosis, there's a calcium deposit of the skin. Then Raynaud's phenomenon, it means there's a spasm of blood vessels which is in response to cold or stress. All right. And esophageal dysmotility, now there's acid reflux and decrease in motility of the esophagus. Okay, so mahihirapang mag-swallow yung patient. Alright, plus there's acid reflux. Okay, so sclerodactyly. Okay, so there's a thickening and tightening of the skin on the fingers and hands. So yung, 'di ba, sclerodactylity yung parang it came from the word nung sa yung dinosaur na may na lumilipad. Okay, so yung hands niya looks like that kind of dinosaur. That's why it's called the sclerodactyly. Okay. So si telangiectasia, all right, this is a symptom wherein there's a dilation of capillaries causing red marks on the surface of their skin. So there's a petechiae. So for example, ganito. Okay, so that's the reason why, all right, there's a red marks no on the surface of the skin. That's because of the dilation of the capillaries. All right, so take note of the symptoms of the scleroderma. Okay, these are your crest. Okay, so crest stands for calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia. Okay. So there are classifications of autoimmune diseases, no? So they can be organ specific. So when we say organ specific, okay, so it means one organ is being attacked, all right, or being affected or being targeted. Okay, so it can be hematologic, it can be endocrine, neuromuscular, renal, kidney, and gastrointestinal disorders. So kapag hematologic, no, hematologic meaning sa blood. Okay, these are your paroxysmal cold hemoglobinuria or the PCH. Warm autoimmune hemolytic anemias, the immune thrombocytopenia purpura. So these are one of the examples for your hematologic disorders. Okay, for endocrine diseases, there's a Graves disease. Okay, so endocrine meaning yung mga hormonal, alright, thyroid mostly. Graves is a thyroid din na disorder, Hashimoto's, okay, and insulin-dependent diabetes mellitus. There's a problem of the hormones, no, the hormonal problems. Neuromuscular disease, such as your myasthenia gravis, your multiple sclerosis. Alright, and when we say renal disorders ng autoimmunity is the good pasture syndrome and the tubulointerstitial nephritis. And gastrointestinal disorders such as the pernicious anemia and the primary biliary cirrhosis. And another classification of your autoimmune diseases is systemic. So when we say systemic, it means there's more than one organ, okay, is being targeted or affected. with the autoimmune or auto antibodies. Okay, so um, such example for your systemic na autoimmune diseases, pinaka-common is the SLE or the systemic lupus erythematosus, no, also common in the Philippines, the rheumatoid arthritis, okay, and the Wegener's granulomatosis. All right, so now let's start first focusing about the systemic autoimmune diseases. All right, so as what I said, SLE is the most common, okay, non-organ specific autoimmune diseases. Okay, systemic lupus erythematosus. So this is a chronic systematic inflammatory disease marked by alternating exacerbations and remissions. Okay, all right. So, when we say SLE, yung hallmark niya na symptoms is the wolf-like, no? Para siyang wolf, parang because of the mask. Bakit siya wolf-like? Because of the symptoms na butterfly rash sa skin, okay, sa face. So, it looks like the mask of the wolf, okay? And there's also a common symptoms such as the joint arthritis. Alright? And after, di ba, kita nyo, systematic siya, marami siyang organs na natatarget. The skin and the joints and even the kidney. There's a renal involvement. Okay? So, diagnosis of your SLE is through the tests LE prep and the ANA screening. Okay? So, for LE, okay, so we check no that the neutrophil, okay, if it has ingested the antibody coated nucleus, okay, to check your neutrophils that ingested the antibody coated nucleus of another neutrophil. All right, so diba, it attacks the self neutrophil against a neutrophil. All right. And so another test is the anti-nuclear antibody screening test, wherein we observe for the homogeneous pattern, peripheral pattern, the speckled, and the nucleolar. All right. Okay. And also we have this test aside from the anti-nuclear antibodies. We have this test fluorescent anti-nuclear antibodies or the FANA, wherein this detects no the wide range of the antibodies of the SLE, wherein 90% of patients with lupus yields positive results. So that's why it's called as the gold standard. And the advantage of this test is to uh, is it's easy to perform, all right, and extremely sensitive no for your autoantibodies against the SLE. But take note, low lang ang kanyang specificity. So, mataas ang kanyang sensitivity, okay, meaning it can detect, alright, it can detect the autoantibodies against the SLE, but it's not specific, no, for your SLE, okay. Many antibodies are associated with the autoimmune diseases, okay. So, as just like for example the homogeneous, the speckled, okay, it can be present no with the other antibodies, for example with the rheumatoid arthritis, okay, and other autoimmune diseases. So pwede siyang mamislead no in the diagnosis of such autoimmune diseases, okay, kasi napakababa ng kanyang specificity. Okay, so another laboratory test no for your SLE is a double-stranded DNA or the dsDNA antibodies, okay, in which this test is most specific for the systemic lupus erythematosus. All right, so there's a presence of antibodies that are considered diagnostic for the SLE, especially when they are found in combination with low levels of what complement component protein. It's your C3. Okay, if mababa ang C3, okay, so um, there's possible for the antibodies for SLE. Okay. this can be used no yung ating double-stranded DNA sa labeled assays. Okay? So other tests for the diagnosis of your SLE is the anti-histone antibody, anti-Smith antibody, okay, the anti-RNP and anti-SSA, anti-SSB. Okay, sa mga Sjogren's syndrome ito. Okay. Now let's proceed with the another autoimmune diseases that is systemic. Okay, is the rheumatoid arthritis. So your rheumatoid arthritis are commonly known as the rheumatoid factor. All right, so these are characterized as a chronic symmetric. Okay, symmetric siya compared with your gouty arthritis. Yung gouty natin is asymmetric, no? So kung mag-swollen yung joint sa kabila, sa left, sa right side is it's normal. But with the rheumatoid arthritis, no, both limbs, for example, the left um, limb na my joint is swollen. The same with the other, no, sa right then. And it's an erosive type of arthritis ng peripheral joints. So it affects the heart and the lungs. Okay, the heart and the lungs, say rheumatoid arthritis. Okay, so aside sa joints, it can also cause or target the heart and the lungs. So there's a presence of abnormal circulation, no, abnormal circulation of IgM autoantibodies, which react, no, specifically with the Fc portion of the IgM molecules. Okay, so ito yung IgG pala. Ito yung IgG natin. Okay, we're in, 'di ba? 'Di ba? Remember yung structure ng ating antibody. This is the Fc portion of your IgG. All right? Now your IgM, no, attaches, okay, or reacts, okay, to your IgG. So nakabind siya doon. All right? So this is now the problem of your rheumatoid. This is now the rheumatoid factor. Okay, so once naka-attach yung IgG, I mean yung IgM doon sa Fc portion ng ating IgG. Alright, so this is the IgG. So what are the clinical key symptoms of your rheumatoid arthritis? So take note, there's a morning stiffness around the joints that lasts for 1 hour. Okay, and swelling of the soft tissues, proximal interphalangeal, metacarpophalangeal, and the wrist joints. So how to diagnose your rheumatoid arthritis? Okay, we have to detect the rheumatoid factor. Okay, we have to detect the rheumatoid factor. So most often, the tests are performed to an initial diagnosis for your rheumatoid arthritis. Okay, so how does this test done? Okay, so via the agglutination. So we observe for clumping. When we see agglutination, we observe for clumping. Okay, visible clumps. All right. Using the sheep's RBC that are coated with IgG. Okay, so yung mga sheep's RBCs, no, are coated. Okay, for example, these are the sheep's RBC. These are coated, no, with your IgGs. Alright, naka-coat yung IgGs. Now, if there's IgM, abnormal IgM in the circulation, then it will attach now to the what? Ayan. Mag-attach na yung IgM sa Fc portion ng ating IgG. Okay. Alright, so that, and when the IgM is attached, no, with the IgG, okay, it now forms the clumps, or the agglutination. Okay, and another type of agglutination for your rheumatoid arthritis detection is the latex particles. No, it uses the same antigen, but of greater sensitivity. So which of the following, okay, tests for your rheumatoid arthritis has greater sensitivity or is more sensitive? Okay, is it the sheep's RBC coated with the IgG or the latex particles? The correct answer is latex particles. All right. Now, rheumatoid factor can also found in other diseases. Right? Dili lang siya hindi lang siya sa rheumatoid arthritis. Okay? So, rheumatoid factor can be found in the syphilis. Okay? In the SLE also. And it can also be found in chronic active hepatitis, tuberculosis, leprosy, infectious mononucleosis, malaria, and in Sjogren syndrome. Okay, so it's not only specific for your rheumatoid arthritis. All right, another test to detect your rheumatoid arthritis is the IgA test and the IgG. So the IgA antibodies are elevated in the early signs of the diseases. Okay, if this is elevated, your IgA, it states that there's a poorer prognosis. Okay, poorer prognosis of the patient with development of what? Take note, bone erosions and systemic manifestations. All right. So, testing for your IgA, okay, for rheumatoid arthritis is done using the EIA, okay, or the enzyme immunosorbent assay. I mean enzyme immunoassay. Sorry, the enzyme immunoassay. Okay, so ay sorry, taka lang. Enzyme, the L. Ah, yeah. All right. Now, other tests for your rheumatoid arthritis is the anti-CCP assay. Anti-CCP means the anti sorry, anti-cyclic. It's anti-cyclic citrulinated peptide antibody. All right. Ayan. So, anti-cyclic citrulinated peptide antibody. Okay. So, it's 74% sensitive, much higher than the other test. Okay. And much specific for your rheumatoid factor. Okay. So, it's much specific for rheumatoid arthritis. So, 35%, okay, of the sorry, this is 40 supposedly. 35 to 40. 35 to 40%, okay, of rheumatoid factor are that are negative, okay. 35 to 40% rheumatoid factor that are negative, no, sa ibang test. Pero pagdating sa anti-CCP na assay, it's already positive. Alright? So, dahil mas specific siya for the rheumatoid factor. Now, the presence of anti-CCP precedes the onset of your rheumatoid arthritis. So, take note of that. Okay. Another laboratory test for rheumatoid arthritis is the ANA antibodies. Okay. The anti-nuclear autoantibodies. Okay, so the the pattern is homogeneous and speckled. All right. And also, please take note, no, sa sa mga test na yung ating acute phase reactants such as the CRP, okay, and the ESR. So these levels increase, no, during the rheumatoid arthritis, and the complement components is also normal or sometimes increase, and this indicates the increased synthesis of the pro-inflammatory cytokines also. So alongside with your other tests, no, with the test for your rheumatoid arthritis, kapag matataas ang ating CRP, okay, and ESR, okay, this supports for the diagnosis of your rheumatoid arthritis. Kasi nga, 'di ba, um, rheumatoid factor can be also increased in some diseases. Okay, So, ayan. Kailangan natin ng mga supporting test, no, for the diagnosis of our rheumatoid arthritis. Another systemic, all right, na autoimmune diseases is the Wegener's granulomatosis. So this is a granulomatosis, okay, granulomatosis, so yung WBCs, na may polyangiitis. Okay, granulomatosis with polyangiitis. So there's an inflammation of small to medium-sized blood vessels. So sa mga medium-sized or mga small na mga blood vessels na nag-inflame. So it affects the upper respiratory system, okay, and even the lungs. So how to diagnose your Wegener's granulomatosis? Via the anti-neutrophil cytoplasmic antibodies, or the ANCAs. Wherein ANCA can be cytoplasmic or perinuclear. So with Wegener's granulomatosis, ang pinaka-specific for your Wegener's are the cytoplasmic anti-neutrophil cytoplasmic antibody. Okay, whereas the perinuclear is found in other diseases. Alright, so kapag increase, no, ang ating CNCA, so this is now specific for the Wegener's granulomatosis. Okay. Now let's proceed with the organ specific, no, na mga diseases. Alright, so let's start with the autoimmune thyroid diseases. So when we say autoimmune thyroid, from the name itself, it targets the thyroid organ. Okay, so in the autoimmune thyroid diseases, it can be called as the Hashimoto's thyroiditis and the Graves' diseases. So both diseases share some antibodies that interferes with the thyroid function. Okay, so this autoimmune response, all right, the thyroid is based on a combination of genetic susceptibility, no, wherein the genes are coupled with environmental triggers. All right, so also there's a genetic predisposition, no, wherein the immune modulating genes, all right, there's autoimmune response in several ways. No, the HLA genes codes to HLA antigens, antigen peptide presentation to T cells. All right, the thyroid specific genes, there's a mutation in the thyroglobulin gene, modifications in the TSH receptor gene. Okay, so what are the clinical signs, no, of your thyroid autoimmune thyroid diseases? For Hashimoto's thyroiditis, okay, it's goiter. Okay, then hypothyroidism with dry skin. There's a decreased sweating, puffy face, all right, edematous eyelids, pallor with yellow tinge, right? And kapag sabihin natin hypothyroid, of course, it gains weight, all right? Dry and brittle yung hair. Hypo, no, kasi wala masyadong thyroid hormones that helps in the metabolism. Okay, so that's why there's dry and brittleness of the hair, even sa skin. And in the laboratory, we can detect the immunologic test, no, via the hyperplasia. There's hyperplasia, no, and increased number of lymphocytes. Okay, cellular type present sa ating Hashimoto's are activated yung T and B cells, take note, and macrophages and plasma cells. And thyroglobulin antibodies, okay, the thyroglobulin antibodies are predominant. Thyroglobulin antibodies are already predominant with your Hashimoto's thyroiditis. Now, in Graves' disease, okay, this is there's an increase, no, of your thyroid hormones, increase thyroid hormones. Compared with your Hashimoto's, it's hypo, but with Graves, there's hyperthyroidism. Okay, there's a thyrotoxicosis happening in the Graves disease. So hyper grave, okay, Graves or grave, hyper. Okay, so in thyrotoxicosis, no, there's a diffused enlarge yung goiter. Okay, enlarge yung thyroid mismo. All right, so it's described as soft, okay, instead of rubbery yung thyroid. Okay, so there's bulged out eyeball. Okay, so nagbulge yung eyeball. So kindly check yung katabi nyo. Charis, joke lang. Alright, so bulge yung eyeball. Patient has a large-eyed staring expression. No, akala mo tinitigan ka ng ano ng malisyoso or kaya may iba siyang intention, but no, large-eyed yung kanyang staring expression because of this hyper secretion of the thyroid hormones. There's nervousness, okay, insomnia, depression, rapid heartbeats, there's palpitations, and if sa Hashimoto's is weight gain, kabaliktaran naman kay Graves, okay? So may weight loss naman siya. Okay, and also there's heat tolerance, sweating, madali lang siyang magpapawis, breathlessness, and fatigue. Okay, so immunologic findings for your Graves' disease. Now, there's the thyroid shows uniform hyperplasia. So, nag-increase or nag-enlarge yung thyroid with patchy lymphocytic infiltration. So, there are a large number of cells that are expressed with your HLA-DR antigens on surfaces in responses to the IFN gamma, interferon gamma. Okay, the interferon gamma. All right. There's a majority, okay, of the antibodies na thyroid stimulating hormone receptors, thyroid stimulating hormone receptors na antibodies for your Graves' disease. All right. Now, how to detect? No, in the laboratory, we have these three major autoantibodies. Take note for your autoimmune thyroid diseases: the thyroglobulin, thyroid peroxidase, and the TSH receptor antibodies. So in Hashimoto's, take note, there's an increased titer of the anti-thyroglobulin. Okay, there's a production of antibodies, no, thyroid uh, peroxidase and thyroglobulin antibodies, okay, which plays for the major role in the destruction of the thyroid gland. Okay, so itong dalawang to are present in Hashimoto's. Okay, thyroglobulin peroxidase and the thyroglobulin antibodies. These are present in the Hashimoto's. All right, so um, once na destroy na yung, it starts to destroy na the thyroid gland, eventually it causes a decline, no, decline output of the thyroid hormones, resulting in hypothyroidism. Right, now in Graves' disease, okay, sa Graves' disease naman, yung pinaka dominant, no, or major na antibodies is the thyroid stimulating hormone na receptor na antibodies. Okay, take note of this. It's most associated with results for your TSH, FT3, and FT4 are unclear, no, if it's not giving us a distinct na values, no, kasi 'di ba yung Graves increase yung ating thyroid hormones, pero if unclear siya, then we refer to the antibodies na thyroid stimulating hormone receptor. Okay, now take note that thyroid peroxidase are found in are among in 90 to 95% of patients having the autoimmune thyroid diseases. We also have another autoimmune disease, that targets the pancreatic organ, which is yung type 1 diabetes. Okay, so insulin dependent yung ating type 1. Alright, type 1 diabetes mellitus. Okay, so it targets the pancreas. Okay, now the patient is insulin dependent. Okay, now there's a new study, that there's another type of diabetes, diba? Type 1 and 2 for diabetes mellitus. Now, the type 3 diabetes mellitus is known to be associated with the Alzheimer's diseases. All right, so the brain in this type 3 diabetes becomes resistant to insulin. Okay, so that's why associated siya sa Alzheimer's diseases. Okay, the brain becomes insulin resistant. Okay, which is similar to the body becomes insulin resistant in type 2 diabetes. So insulin is important for memory and brain cell survival. So impaired insulin, okay, signaling in the brain may contribute to neurodegeneration. Okay. So again, take note if type 3, okay, diabetes mellitus, so it targets the brain. Okay, so type 3. So para ma-remember si 3, 'di ba, yung brain natin, mga convolution siya. All right. Okay, para hindi malimutan. Okay, it determines about the insulin resistance of the brain. All right. Okay. So however, your type 3 diabetes mellitus is not fully published yet. Okay, but there are already journals, uh, indicating of the type 3 diabetes. So there's too much insulin resistance can affect the brain, causing the DM type 3. And take note, yung type 3, type 3C, okay, na diabetes mellitus, ito yung nag-target ng pancreatic damage. Okay? So, I mean, this causes pancreatic damage. So, tina-target niya yung pancreas. Alright. Which is, yung type 3 diabetes is now an official or already official, for medical diagnosis. Okay, official na siya for medical diagnosis. Okay, again, type 3, yung brain. Type 3C is the pancreatic damage. Alright. Okay, now let's proceed to another organ-specific type, autoimmune diseases, the multiple sclerosis. Okay, so when we say multiple sclerosis, there's an inflammatory autoimmune disorder of the central nervous system. Okay, there's a combination of genetic and environmental factors that cause the multiple sclerosis. Okay, so this can be triggered by the molecular mimicry. Okay, ginagaya yung, okay, um, yung mga antibodies or yung, I mean, kung ano yung meron uh, sa HLA class 2 molecules, to the T cells. Okay, ginagaya niya yung HLA class 2 molecules, to T cells. Alright, so there's a mimicry. So it appears to be an additional genetic link to polymorphisms in the gene coding for the interleukin 7 receptor. Alright, so what are the clinical symptoms of your multiple sclerosis? Now, there's visual disturbances, weakness or diminished dexterity in one or more limbs. Okay, so locomotor incoordination, dizziness, facial palsy, and there's tingling or the pin and needle sensory abnormalities, kasi yung mga nerves mismo yung nata-target. So what are the immunologic findings for your multiple sclerosis? T cells and macrophages that orchestrates demyelination, The antibodies bind to the myelin membrane, initiate immune response, stimulating macrophages and specialized phagocytes, microglial cell. Okay, so another is the oligoclonal binding and CSF IgG index. Okay, the immunoglobulin is increased, no, wherein sa ano na specimen, spinal fluid, among 75 to 90% patients, producing several distinct bands on protein electrophoresis that are not seen in the serum. For multiple sclerosis, di ba kasi target yung central nervous system. Okay, so yeah. Now another test, another immune autoimmune disorder is the myasthenia gravis. So your myasthenia gravis, it targets and affects your neuromuscular junction. So yung myasthenia gravis is characterized by weakness, no, ng skeletal muscles. So the antibody-mediated damage to acetylcholine receptors. Okay, 'di ba yung acetylcholine? 'Di ba? It helps what? It helps the contraction. Okay. All right. So it damages this acetylcholine, no, na receptors. So if damage yung acetylcholine receptors, the effect is kabaliktaran. No, walang contraction, so there's weakness. Okay, always siya relax. Okay, so walang contraction, so weak yung skeletal muscles. So what are the clinical signs, no, of your myasthenia gravis? There's drooping of the eyelids, and there's inability to retract the corners of the mouth, resulting to snarling appearance. Okay, ito yung isa sa common, snarling appearance. There's difficulty in speaking, chewing, and even swallowing. There's also inability to maintain support of the trunk, the neck, or the head. So lupay-pay, 'di ba? Para siyang yung floppy, yung ano, yung ating symptoms ng ating myasthenia gravis. Okay? So patients have antibody to the acetylcholine receptors. Okay, so there's binding of acetylcholine in the receptor. I mean yung receptor, no, na ating acetylcholine is being blocked. All right, so hindi siya makaka-release ng acetylcholine or kaya yung um, um, contraction, walang contraction, no, na mahahappen because blocked yung acetylcholine receptors. Okay? So the result is there's muscle weakness. Okay? So to detect your myasthenia gravis, no, the test is known as the radioimmunoassay. Okay? There's wherein the antibody, okay, is being detected, no, this antibody that blocks the acetylcholine receptor, no, the binding of the anti-ACH receptor. All right. Okay. And last but not the least about the organ specific autoimmune disorders is your good pasture syndrome. So your good pasture syndrome is being detected, no, using the circulating antibodies via the RIA, okay, the EIA, and the IIF, or the indirect immunofluorescent assay. Okay, so in indirect immunofluorescent assay, among the mga tests for your good pastures, no, the IIF, or the the indirect immunofluorescence assay, this uses frozen kidney sections that are incubated with the patient's serum and overlaid with a fluorescein labeled anti-IgG. Alright. Also, Western blot for your good pastures, which the Western blot separates the basement membrane of the antigen by polyacrylamide gel electrophoresis, and followed by the transfer of nitrocellulose paper for immunoblotting. So this Western blot is used for confirmatory tests, no, for your good pasture syndrome. Okay. And EIA technique uses 3 alpha subunit no, to detect your antibody. Okay. And so now let's proceed with the immunodeficiency. So when we say immunodeficiency, these are disorders in which there's a part of the body's immune system is missing or dysfunctional. Okay, so from the name itself, immuno, okay, the body's response to antigens, but deficient siya. Okay, deficient yung response ng ating body towards the antigens. Okay. So, indicated by recurrent infections sa ating immune deficiencies, chronic infections, and poor response to treatment. Okay. So, your immunodeficiencies can be classified as primary and secondary. When we say primary, these are inherited. Okay. So, genetics yung ating primary. Alright. Now, ang ating secondary, alright, is um, influenced by these factors, no? The nutritional deficiency, aging, okay, chronic disorders, even drug therapy, lifestyle, stress, and viruses. Okay, so one of the examples no sa secondary na immunodeficiencies, for example, um, vitamin C deficiency, okay, which are common. Saan ito common? Sa mga seafarers. Okay, vitamin C deficiency. Alright? No, kapag or deficiency or decreased yung ating vitamin C. Okay? Among sa mga seafarers. I mean, common ito sa mga seafarers. Okay? So, when we say vitamin C deficient or decreased, ano nga yung tawag sa sakit nito? It's the scurvy. Okay. Alright, kasi okay, less or kaya deficient yung ating vitamin C. Okay. Now, your immunodeficiency disorders, is what I've said, it's being classified as primary or the genetics, and secondary is from the lifestyle. Alright, so primary immunodeficiencies are also classified according to no its disorder. If the disorder is specific yung immunity, okay, or complement yung deficiency, or disorders of the phagocytosis. No, there's a phagocytic cell defects, no? Yung phagocytosis, yung mga phagocytic cells natin. No, there's a disorder or dysfunction na ating phagocytic cells. Okay, so your phagocytic cell defects can either be quantitative, no, konti yung quantitative, konti or no levels of the phagocytes. Okay, or it can also be qualitative. Okay, yung kanyang function. Okay, hindi na siya it's not phagocytic, qualitative. Okay, or it's not responsive of the cytokines or mga chemotaxins, no, in which hindi siya nagre-respond to the signals, right, for killing certain pathogens. Okay. Now, in the disorders of the specific immunity, it can be B cell deficiency. Alright, so pwedeng hindi siya nagre-release ng antibodies. Okay, the T cell deficiency and also combined immunodeficiency. Alright, okay, take note of this para di malimutan, no? Mas better na ma-remember no, via the flow chart. Okay. And now let's proceed to the other discussion no, of your immunology, which is the transplantation immunology. Okay, isa ito sa pinaka-importante, and we really need to understand and know about transplantation immunology, lalo na ngayon, 'di ba na padami na padami ang mga or kaya padami ng padami ang mga cases ng mga transplantation, especially kidney transplant, 'di ba? Okay, so we need to understand, no, yung importance ng transplantation, no, para maintindihan natin yung pag-accept ng organ or kaya pag-reject ng organ. Okay? So now let's start with the transplantation immunology. So yung transplantation immunology, we refer to the major histocompatibility complexes, or the MHC. Okay, major histocompatibility complex. No, these are the cluster of genes that are found on the short arm of chromosome. Take note, 6. Okay, at band 21, which code for proteins that have a role in the immune recognition. Okay, the immune recognition of the human leukocyte antigen. The goal of the MHC, or the transplantation immunology, is to understand the major immunologic barriers to a successful tissue and organ transfer. Okay? All right. So, the MHC gene products were also identified, as the responsible for graft or transplantation rejection. Okay. Okay. So if there is rejection, nako, napakasakit ng rejection. Okay? If yung graft or transplantation is being rejected, no, one of the major na reason is your major major histocompatibility complex. Okay. So what is the significance of transplantation immunology? So yung transplantation is a potentially life-saving treatment, especially for end-stage na ng mga organ failures. Okay, end-stage na kidney failure, alright, or liver, okay? So, kailangan siyang ma-transplant, alright, para ma-save pa yung patient. Okay, so also cancers, no, autoimmune diseases, and mga immune deficiencies. Alright, so what is the primary immunologic barrier for your this test? Okay, so it's the human leukocyte antigen, the HLA system. No, siya yung strongest immunologic barrier to a successful allogenic solid organ and hematopoietic stem cell transplantation. Okay, siya yung barrier, siya yung antagonistic, kumbaga. Siya yung kontrabida. Okay, yung ating HLA. So when we say HLA, these are molecular basis for your T cell discrimination of self from non-self. Okay? So, T cell discrimination, ano ba? Ano, na, yung discrimination ng T cell, no, in detecting self, no, from non-self. Okay. Discrimination. Okay. All right. So your MHCs are classical transplant antigens. Okay, they are known as the classical transplant antigens, or the classical transplant antigens are known as the MHC, or the major histocompatibility complex. No, and in humans, these MHCs are called as the human leukocyte antigens. So these are expressed, no, on the surface of nucleated cells. Your HLA are expressed on the surfaces of all nucleated cells. They are critical recognition elements for antigen receptors on T lymphocytes, initiating adaptive immune responses. So your MHCs are involved in the transmission reactions, okay, especially for ABO, major, no, yung ABO na blood transfusion reactions. Okay, ABORH, I mean. Okay, graft rejections, autoimmune diseases, and even on the paternity test. Okay, so ang pinaka main role ng ating MHC, by the way, is during the antigen presentation, okay, of your T cells. antigen presenter pala to T cells. Okay. So, ayan. So, your MHC has these characteristics na polymorphic. There are so many possible alleles at each location to increase chances of interacting with the diverse self and non-self antigens or the immunogens. Okay, it's the most polymorphic genetic system of the human. All right, so may extensive allelic diversity. Okay, that restricts the ability to transplant tissues between two individuals. All right, so your MHCs or the HLA system is divided into three categories or classes. It's class 1, 2, and 3. Now let's differentiate the three classes, okay, according to its genes. Your class 1 has genes HLA A, B, and C. Okay. Now class 2, okay, so si class 2, yung HLA niya is D. Okay? D, but may mga um, may mga nakakabit na DR, okay, Q and P, okay? So your class 2 are HLA DR, HLA DQ, and HLA DP. D, tapos R, Q, and P ang nakakabit doon sa ating HLA D. Okay? So HLA DR, DQ, and DP, no? All right. So ayan. Your class 3 proteins, there are no known na mga there's no full study pa as to the class 3 proteins, no? So but they are known to be expressed in the blood and other secretions. Okay, so ito lang yung intindihin natin about class 3. All right, so let's focus on the differentiation of class 1 and class 2 proteins ng MHC. So your class 1 is expressed on the nucleated cells, whereas your class 2 are expressed primarily on the antigen presenting cells. So sino yung mga antigen presenting cells natin? Remember, these are your dendritic cells, no, mga monocytes, and your B lymphocytes. Okay. So there's a when we say T cell interaction, no, your class 1 interacts with the CD8, okay, on cytotoxic T lymphocytes, okay. So your class 2 interacts with your CD4, okay. All right. Now the structures of each proteins, no, your class 1, ito yung mga heterodimers that consist of heavy chain covalently bound to the beta 2 microglobulin. Okay. Though your class 1 proteins also has these alpha chains and beta chains. Okay. All right. All right. So yung alpha chain naman, it has alpha 1, alpha 2, and alpha 3. Okay. All right. So the polypeptide chain are anchored to the cell membrane of the beta chain. Okay. So the beta 2 microglobulin, okay, yung heterodimers natin has heavy chain that are covalently bound to the beta 2 microglobulin. All right. Okay, now in class 2 proteins, no, heterodimers din that consist of two different polypeptide chain. Okay, ang ating class 2. So class 2, two different polypeptide chains. All right. So what are the other histocompatibility systems and graft classifications? No, so these are your ABO blood group antigens, no, in which incompatibility is barrier to solid organ transplantation. Okay. So minor histocompatibility antigens are the MHAs, no, non-HLA proteins that cause rejection Okay, even in MHC identical transplants. They mediate in a slower rejection pace and and targets in HLA match sibling um, transplants leading to um, GVHD, graft versus host na disease. Okay. Now, MICA antigens, MICA stands for MHC, major histocompatibility complex, class 1 related chain A. Okay, the major histocompatibility complex, class 1, okay, related chain A. Related chain A, or the MICA antigen. Okay, so these are polymorphic cell surface proteins that are expressed on endothelial cells. The antibodies against them are associated with the rejection and decreased graft survival. Okay, so there are different types of grafts, no? So these are your autograft, meaning self graft. Okay, so tissue transferred within the same individual. When we say syngenic graft or the isograft, the tissues are transferred between genetically identical, okay, identical individuals of the same species, such as mga identical twins. The same lang, human to human. Okay, allograft, okay, tissue transferred between genetically disparate members of the same species. All right, and xenograph, no, transfer between individuals of different species. Okay. Now, most immunogenic to list na organs, okay? Ang pinaka-immunogenic is the bone marrow, followed by your skin, heart, kidneys, liver, then bone, synogenic valve replacements, and ang pinaka-least no na immunogenic no for transplant is cornea. Okay? Most immunogenic, take note, is bone marrow. Least is the cornea. Okay, so tandaan po natin ito. Alright? Okay. Now let's proceed to tumor immunology. When we say tumor immunology, it's the study of the antigens that are associated with tumors. Okay, so there's an immune response to tumors. The tumor effect on the host's immune status and the use of the immune system to help eradicate the tumor. So cancer begins with the changes in one normal cell, okay, and these changes allow the cell to grow and proliferate without regard to normal growth signals or controls. So these abnormal cells grow and continue to mutate. Okay, as they mutate, they may show differences in the gene expression, both in type and amount. Now, your antigens expressed in greater amounts in tumor tissues are called the tumor-associated antigens, or the TAAs. Okay, all right. So in tumor immunology, we often use the terms no, neoplasia. Okay, so when we say neoplasia, this is this determines to the uncontrolled growth of the normal cells. Okay, there's an uncontrolled growth of normal cells. So your neoplasia can be benign or malignant. When we say benign, no, these are not immortal and does not invade. Okay, it does not invade healthy tissue extensively. Sometimes your benign are capsulated, in which it cannot metastasize, so it cannot spread out. Okay, so look, isolated lang siya, no, to a certain area. Now, your malignant neoplasias, no, can be immortal, all right, progressively invasive, and cancerous, right? It invades normal tissues. Now, your malignant can be carcinoma, no, which arises from the endodermal, Okay, endodermal or carcinomas or ectodermal epithelial tissues. Your sarcoma, I mean sarcoma, this arises from mesodermal connective tissue. And leukemia and lymphoma, these are malignant tumors of the hematopoietic cells, no, sa blood na mismo of the bone marrow. So when we say metastasis, no, it moves through the blood or lymph to new sites. Okay, may spread out from blood or lymph to new sites. There's small clumps of cells that break off and spread where they continue to grow. When we say proto-oncogenes, no, these are the genes that normally regulate the initiation and expression of normal cell division. Okay? And oncogenes, these are the mutant forms of the proto-oncogenes that contribute to various tumor types of the malignant transformation. Okay? So, oncogenes na known na mga oncogenes are the NF1 and the RB. NF1 for neurofibromatosis and retinoblastoma. Blastoma. Okay. So, the tumor antigens can be tumor-specific antigen and tumor-associated antigen. When we say tumor-specific antigens, these are not found on the normal somatic cells, okay, but result from the mutations of genes. Okay, there's a mutation of gene. And these tumor-specific antigens are only found in patients with tumor, but not in healthy cells. Of course, specific siya with the tumor. Okay? Tumor-associated antigens are not unique to tumor cells, but antigen expression has been altered and can be expressed in excess where it could not normally exist. Okay, such as the oncofetal antigens, such examples nito is the alpha fetoprotein and the carcinoembryonic antigens, in which um, these are expressed no sa mga tumors and mga normal fetal cells. Okay? And your TAA are found in healthy cells but overly expressed in tumor cells. Okay? Take note of the difference. Ang TSA, tumor specific cells, they are not found in healthy cells. Healthy human, okay? Doon lang sa mga may patients na may tumor. Ang tumor associated antigens naman, they can be found in healthy cells and are overly expressed in the tumor cells. Okay, so here are the different categories of your protein or antigen tumor markers. So kindly take note, no, of their tumor marker classes and their examples and their disease associations. So when we say cell surface markers, these are your estrogen, progesterone receptors, and the CD markers, no, on the white blood cells. So the estrogen, progesterone receptors, these are associated with the prognosis for hormone therapy in breast cancer. Okay, our estrogen, progesterone receptors, or the ERPRs, estrogen receptor, progesterone receptors. Okay. Now the CD markers, these are associated with clonality and lineage of the white blood cells. Remember, no, yung mga CD markers natin sa surfaces natin white blood cells. They are associated with white blood cell neoplasms. Alright, now in the category protein for your antigen tumor markers, no, sa proteins naman, yung thyroglobulin natin and immunoglobulins and mga antibody light chains such as for Benz-Jones proteins. Okay? For your thyroglobulin, these are associated in well-differentiated papillary or follicular thyroid carcinoma. For your immunoglobulins, Benz-Jones proteins, no, it can be associated in the multiple myeloma and lymphoid malignancies. Now, the oncofetal antigens, one of the examples of your oncofetal antigens are the alpha fetoprotein and the carcinoembryonic antigen, or the CEA. So, in the alpha feto 1 protein, or alpha 1 fetoprotein, I mean, it's associated in the germ cell carcinoma and hepatocellular carcinoma. For your CEA, no, automatic breast cancer, colorectal carcinoma, and also these are also found on some other diseases. So mamaya malalaman natin yan. Carbohydrate antigens, no, such as your CA, carbohydrate antigen, CA125 and 15-3. So 125, 'di ba? Remember yung 5, okay? So ovarian cancer, 'di ba yung ano ba tong dinawin ko? Yung appearance ng ating ovaries. Okay, sa mga babae. Okay, so yung 5 may look like yung sa ovary. Okay, yung dulo ng 5. Ayan, so ovary. Ovarian yan. Ovarian cancer, 'di ba? Kasi nga yung ating ovary, no, for example, this is the fallopian tube, and then ito yung ating, hindi ako marunong drawing, ito yung ating uterus. Okay, so these are the ovaries. So ito yung ano ng 5. Okay, ovarian cancer. So yung 3 naman, yung 3, no, pwede siyang sa boobs. Okay, for the breast cancer. Ayan, yung nipples. Okay, para hindi malimutan. Okay. So blood group antigens, no, sa your carbohydrate antigen na 19-9, which is, take note, yung 19-9 is related to the Lewis antigen. Wow, Lewis antigen 19-9. So pancreatic and gastrointestinal cancers din naman siya. Okay, para di malimutan, pancreatic and gastrointestinal. So your pancreas looks like this, and then the intestine. So yung 9. Alright. Okay. So enzymes or isoenzymes na group natin or class ng tumor marker natin. No, this can be prostate-specific antigen, the PSA, alkaline phosphatase or ALP, or ALKP. Some textbooks, no, are abbreviated this as ALP. Okay, the neuron-specific enolase also. For prostate-specific antigen, of course, hindi na mag-isip. Press the buzzer, is your prostate cancer. For alkaline phosphatase, bone and liver cancer. Neuron-specific enolase is the neural tissue neoplasms. Alright. Another tumor marker class is the hormones. Okay, the human chorionic gonadotropin, or the HCG, no, wherein it is associated with the germ cell carcinoma, trophoblastic tumors, okay, calcitonin, medullary, thyroid cancer, and the gastrine is the pancreatic gastrinoma. Alright. Okay. Now, there are tumor markers that are useful for cancer screening. Alright, so such as your prostate, no, na cancer type, again, paulit-ulit, no, yung prostate-specific antigen. It can be total and free, no, na PSA. So, ayan, no, ang test for this is the digital rectal exam. Okay, aside from the levels of your PSA, so dapat makikita na, for example, increase ang PSA, it will also reflect, no, to the measurement of the prostate if there's enlargement, no, so kaya i-check via digital rectal exam. Okay, so mas makita kasi doon yung rectum, yung rectum, yung sorry, yung prostate. Okay, via the digital rectal exam, and then it measures now the wherein the prostate can be measured, no. So according to studies, men over 50 years old, okay, and with at least 10 years of life, no, na expectancy. Alright, so kailangan i-detect na, no, for, or kaya may screening na for PSA. Para the earlier, no, na ma-detect na may possibility for prostate cancer, okay, so kailangan may screening na yung mga lalaki. Alright, and take note, lalaki lang po ang may prostate. Okay, remember, walang prostate ang mga babae. Okay, now colorectal cancer. Okay, so markers, no, is the fecal occult blood. Remember nyo yung fecal occult blood? Okay, so if this test, no, is positive, it's an indication na may colorectal cancer. So another parang supportive na test is the genetic testing. Okay, all right. Now liver cancer is yung kanyang marker alpha 1 fetoprotein na via ultrasound din to determine aside sa high levels of alpha 1 fetoprotein, i-check via ultrasound, no? I-measure kung may enlargement ba ng liver, no? Okay, and ovarian cancer, which is the CA125, also isa sa kanyang supportive na diagnostic test is the ultrasound. Alright. Okay. Now your alpha 1 fetoprotein is not specific only for liver. They can also it can also determine, no, if it's non-seminomatous testicular cancer, can be germ cell cancer or liver. Okay, all right. So these are normally found in the fetal liver and yolk sac, no. So sa mga fetus, developing fetus, mataas yung AFP. Okay, and adult liver also. All right. So non-cancerous conditions, no, that are elevated na AFP, hindi naman lahat na if increased ito, meaning may cancer na. Okay, so one of the conditions, no, such as the pregnancy, kasi nga may developing na fetus. Okay, non-neoplastic liver disease. Alright, so increase din yung AFP. Okay, beta-2 microglobulin is commonly found in the lymphocyte malignancies. Alright, so MHC class 1, yung kanyang normal source ng ating beta-2 microglobulin. Okay, remember, di ba yung kanyang indication doon sa ating na-discuss about the MHCs. Alright, so also your beta-2 microglobulin are increased in the inflammatory and high cell turnover conditions. Okay, so your calcitonin and your calcium ions, no, are indicators of the familiar medullary thyroid carcinoma. Alright, and they are normally found in your thyroids. Now, take note, in hypercalcemia, meaning mataas ang level ng calcium sa blood, increased calcitonin is expected. Serum calcium may be low when calcitonin is elevated in medullary carcinoma. Alright. Another marker is the CD marker, wherein again kapag CD, diba, they are common or on the surfaces of the white blood cells. So therefore, if mataas yung CD, then therefore there's a abnormality or cancer na sa WBCs. Alright, these are from the WBCs. So WBC increase such as the infection. Okay, if WBC is increased in infections, then the CD markers can also be elevated. Alright. Now, CEAs are the carcinoembryonic antigen. Now, it means that there's a colorectal cancer and even breast cancer. So, hindi lang po, okay, si CA 15-3. Alright, or ang may mataas or elevated na values. Okay, CEA can also be associated with the breast cancer. Alright, so these are normally found on the tissues of the endodermal origins. Alright, so another conditions that may be associated with the elevated CAs is the renal failure, no, non-neoplastic liver, and intestinal diseases, and even to the elderly, or kaya sa mga aged na mga population. Also, take note that CEAs are increased with age and even in smokers. Okay. Alright. Doon na-discuss natin ito kanina. CA125 is for ovarian adenocarcinoma. No? Saan ba siya galing? From different cells, various cells. So it can also be increased, no? CA125 can also be increased in endometriosis na cases, pelvic inflammatory diseases, the uterine fibroids, and even in pregnancy. Okay. So kailangan siyang um, may additional na or additional or alongside the mga test, no? So ano nga yung parang supportive na kanyang diagnostic test, 'di ba? CA125 along with the ultrasound to detect, to check if may enlargement or may abnormal size ng ovaries. Okay? So please take note, no, that in CA125 you are not allowed to collect specimen, or it's not recommended to collect specimen during menstruation. Why? Because it causes false elevation of the CA125. Okay, during menstruation. All right, now let's proceed to CA15-3. In 15-3, now this indicates breast cancer, and also it can be increased in pancreatic, lung, colorectal, ovarian, and even liver cancers. Okay, so these are normally found in the mammary tissue, and the levels of CA15-3 are elevated in the benign breast disease. Okay, also in benign liver disease. Okay, now the epitope of epicyaline 15-3 is monoclonal antibody. Okay, others are 27, 29, and 549. Now the CA19-9 marker is pancreatic cancer, okay, or gastrointestinal. So these are found, no, on the sialylated Lewis blood group antigens. Okay, 19-9 is Lewis. Okay. So benign hepatobiliary and pancreatic conditions, no, elevated din ang ating 19-9. So also they can be elevated in some non-pancreatic malignancies. So these are subjected to Lewis antibodies, Lewis A and B negative, no? Take note, your Lewis A and B negative cannot synthesize your CA19-9. Alright, kaya natin to. Malapit na tayo matapos for the tumor markers. Now, the ERPR, or the estrogen receptor or progesterone receptor, now they are indicators of breast adenocarcinoma. Okay, now ERPR positive breast cancers, they benefit from estrogen progesterone reduction therapy. Okay, so if fecal occult blood for colorectal cancer. Okay, so there's kindly take note. No, these are also increased in the peroxidases in the feces that are other than blood. Okay, so mga certain foods. Okay. So heme functions, the heme of the blood functions as a peroxidase and can be detected chemically. So better specificity with antibodies against globin chains of the hemoglobin. Alright, now the HCG, or the human chorionic gonadotropin, no, are seen in non-seminomatous testicular cancer, germ cell trophoblastic hydration, hydatidiform mole, choriocarcinoma. Okay, so these are found in the placenta, and elevated siya during, of course, pregnancy. Okay, so take note that your HCG high homology with luteinizing hormone. Okay, So malignancies can produce free alpha and beta chains, as well as intact alpha beta dimer. Right now, the immunoassays that detects only intact HCG should not be used for tumor marker detection. So in germ cell tumors, both AFP and HCGs are elevated. Okay. Now, another common tumor markers no, are the HER2 new. HER2 new is for breast cancer, in which are also elevated. No, or I mean they are expressed. Sorry, they are normally expressed in the growth factor genes in all cells. Okay, now cancer associated with overexpression of HER2 new and good response to monoclonal antibody therapy, such as the trastuzumab, alright, na therapy. Monoclonal free antiglobulin or free immunoglobulin light chains. No, so these are your plasma cell carcinoma and the beta, I mean the B cell carcinoma. Okay, so they are normally found on the normal immunoglobulins, no, and that are polyclonal. Okay, so they are elevated in monoclonal gammopathies and amyloidosis, non-secretory myeloma. So the monoclonal free Ig light chains in Benz-Jones proteins are okay, which are detected in the urine by heating. Okay, so by the way, this method is already historic. Okay, so pinaka matagal, pinaka ano din siya, um, pinaka old method to detect your Benz-Jones proteins. So monoclonal IGs, another marker no, for plasma cell cancer and B lymphocytes. Okay, so these are found on the, again, polyclonal na mga immunoglobulins. Monoclonal gammopathy of the undetermined significance, no, increase din yung ating monoclonal IGs that are not free or that are not IG light chains. Okay. So monoclonal IgG or IgA, multiple myeloma. But monoclonal IgM is in Waldenstrom's macroglobulins. When we say IgG, IgA sa multiple myeloma, IgM naman na monoclonal is in Waldenstrom's macroglobulinemia. Okay. Now the PSA for prostate cancers. Okay, these are also elevated no, in the UTI or prostatitis and benign prostatic hypertrophy. Okay? So, yung mga nag-increase lang na, nag-enlarge lang, I mean, na sizes of your prostate. Okay? So, increase din yung PSA. So, these levels are directly proportional to prostate size. Okay? The more siya mag-enlarge, the more siya increase ang values. So, many elevations are benign or not clinically significant. The decreased percent of your free PSA and 0. Or more than 0.5 milligrams per ml per year increase. Okay, so the PSA velocity more associated with malignancy. Alright, so if mag more than siya ng 0.5 milligrams per ml per year nag-increase, then it's associated with malignancy. So it's better to collect the specimen before the ejaculation. Alright, and so there's also a test no to confirm for your PSA's digital rectal exam. Dapat makita na may enlargement ng prostate or the prostate manipulation. Okay, so parathyroid hormone and calcium ions no is a marker for the parathyroid carcinoma. Okay, so they are normally secreted or normally found from the parathyroid glands. So in hypocalcemia, the PTH is increased, no? Hypocalcemia kasi nga um yeah, serum calcium may be high when PTH is elevated in the parathyroid carcinoma. So take note that the PTH has a short half-life. Okay? So that's why levels are done intraoperatively to ensure complete parathyroid tumor removal. Okay, take note, your PTH detection is via intraoperatively. Okay? Kasi nga madali lang siyang mawala, short lang kayang half-life lang. Short na kayang half-life. I mean, short na kayang half-life. Okay? So, para ma-ensure ang complete parathyroid no tumor removal. Oh, sorry. Now, thyroglobulins are markers for your thyroid cancer. All right. So these are also elevated, no, um, in thyroid mass, if there's injury and if my abnormality din sa TSH levels. Now, the thyroid markers T3, T4, and TSH are generally normal in thyroid cancers. Okay, so kaya thyroglobulin yung marker for your thyroid cancer. Assays must simultaneously test for thyroglobulin antibodies, in which it can lead to false decrease. Okay, so often tested after TSH stimulation to see if thyroglobulin increases. Also, it can withhold thyroid medication to increase TSH in patients with thyroid gland removed. Okay, right. So here are the laboratory tests for tumor marker detection. Okay, so one is the cytogenetic studies, wherein cancers are associated with particular karyotype. Testing of aberrant genes, no, in cytogenetic studies. So there's a precise knowledge of gene defects. Okay. Also, there's also a test for tumor marker detection. It's the nucleic acid amplification technique, or the NAAT. Okay. So NAAT uses PCR, or polymerase chain reaction. Okay, NAAT, wherein there's variants, no, increase the inherent levels of the DNA or the RNA. So this allows the detection of small populations if cancer cells includes cell in metastasis. Alright. Now, NAAT also detects all cell mutations, deletions, and even genes, gene rearrangement or translocations. Alright. So take note that BCR-ABL are markers for your myelogenous leukemia monoclonal expressions of the beta cell, B cell DNA rearrangement. Alright. Now also the FISH, or the fluorescent in situ hybridization, is used to detect the tumor markers. Nucleic acid capable of binding to the sequence of interest are tagged with fluorophores. Cells containing the sequence are visualized through a fluorescent microscope. Alright. So, your laboratory tests to detect also your tumor markers are the non-nucleic acid markers, such as the cell surface markers, the protein antigens, oncofetal, carbohydrate antigens, blood group. Remember yung mga um, classifications natin na discuss kanina, no, for your tumor markers. So these are the immunologic methods, okay, wherein the antibodies are distinct, no, to the epitopes of these markers and or antigens and molecules. Okay, and so that ends our discussion about the immunology.